Thank you, Madam Speaker. Medical assistance in dying is a serious issue and unimaginably stressful for patients and their families. The issue, albeit new and evolving in Alberta, should have garnered the utmost attention of the Minister to make sure patients and Albertans were not falling through the cracks. To the Minister of Health, what steps did you take during the implementation of medical assistance in dying to ensure timely access to services?
Good question. Honourable Minister.
Thank you very much, Madam Speaker, and certainly thank you to the member for the question. This is an incredibly important and personal topic for arguably every Albertan in some way, Madam Speaker. And we have been following the federal legislation and making sure that we roll out the right to choose a medical assistance in death throughout our province. I'm proud of the kinds of national recognition we've received, but certainly there's more work to be done because we know that there are some people who have found it difficult to access that choice, Madam Speaker, and that is certainly not acceptable.
For supplemental.
Thank you, Madam Speaker. Minister, you are aware that at least 2 Albertans over 2 years ago were faced with difficulties in accessing medical assistance in dying. To the same Minister, why didn't you act when you were first made aware of the problem, and why didn't you address these issues until they became public?
Honourable Minister.
Thank you, Madam Speaker. And again, the legislation, federal legislation, just came into effect slightly over 2 years ago, and in the months following that, there certainly were some situations that were very difficult for family. I want to thank Doreen Nowicki's family for sitting down and meeting with me to discuss what they experienced, particularly the assessment that happened outside of hospital and how difficult that was for them. And I can imagine any other family could imagine how difficult that would be for their loved ones. So what we have done is we've addressed those concerns, and we've made sure that the new model continues to work in a way that honours, respects patients and their choices, Madam Speaker.
Second supplemental.
Thank you, Madam Speaker. Medical assistance in dying presents an ethical dilemma for some health service providers, and we should respect and accommodate those beliefs. However, the first concern must always be for the wishes and well-being of the patient. Respectfully, Minister, your actions have demonstrated that in these particular cases, patients, Albertans, seem to be an afterthought. To the same Minister, what is your plan going forward to ensure Albertans aren't forced onto the street to access legal medical service? And can you ensure that your ministry is patient-focused and not politically focused?
Honourable Minister.
Thank you very much, Madam Speaker. And again, I want to say that the way that Mrs. Nowicki was treated, in my opinion, and I think in the opinion of all, is unacceptable. That is not something that we would want for anyone that we love or for ourselves, Madam Speaker. And every patient in Alberta deserves to access a high level of dignified, compassionate care, no matter where they are and what health facility they might be in. I've asked Covenant Health to update their policies to reflect the amended practice. Certainly this fiscal year, nobody has had to be removed for an assessment to be done. I've asked them to make sure that they update their policy to reflect that that will be the expectation moving forward, and if it doesn't do so, I will act myself, Madam Speaker.
Honourable members, just a reminder that there will be no preambles on supplementaries. The Honourable Member for West Yellowhead.